Hello, I am Dr. Navdeep MBBS DNB from Haryana, India. Today in this video, we will be discussing various important questions like how to choose a doctor, how to know how many grafts are required for you, or how many grafts have been planted in your head, can you count the grafts, and what will be the cost of hair transplant, are PRPs necessary after hair transplant, and how many months after surgery do you need to take the medicines? Are they compulsory? And is booking required for hair transplant? So we'll be starting with the first question, that is how to choose a doctor. It is very easy. I have already told in many of my videos that choosing a doctor is very easy. Just go for any clinic where a minimum doctor who is minimum MBBS by qualification is doing the surgery by himself. He should do all the punching and slitting. All the punching means taking out the grafts and slitting means making the holes. Both of these works should be done only by a qualified doctor. How can you know whether a doctor is qualified or not? Any qualified doctor will have his or her name on the board outside his clinic, along with the degrees, that whatever degrees he is MBBS, MD, MS, or whatever degrees that doctor is having. So just look for the name of the doctor outside the clinic on the board along with his degrees. If he is a qualified doctor, he has minimum 4 or 5 years of experience, then your surgery will be a success, it will not fail. That is about the doctor. Next is how many grafts will be implanted on your head and how can you count the grafts. This is the major gray area, that there is a fraud in this field, in my field of hair transplant. Basically, it is not very easy to count the grafts. So to get an idea, what you can do is just take a high resolution photograph of your transplanted area after the transplant, magnify it on a laptop, then you can count each graft manually. That will give you a rough idea of how many grafts have been planted on your head. But most of the clinics or most of the doctors may not agree with your count. Okay, but this will give you a rough idea and estimate that okay, this is my number of grafts. But again, it is very easy to fool a person. There may be dead grafts in them, there may be transactions in them which you may count as grafts, but they may not be real grafts. They may be actually be transactions. If you go for a substandard clinics where doctor himself is not operating, then you are bound to be cheated by one method or another. They will put less number of grafts, but they can easily show you more number of grafts by any method, anything. Okay, so what will be the cost of transplant? Cost of transplant varies from clinic to clinic. Never choose a clinic on the basis of cost, either costly or cheaper, does not matter. Just look for the doctor, his qualification, his degrees, his experience, whether he is doing the surgery by himself or not. If you are satisfied by his work, then go for the doctor. Cost should not be a material, should not be considered when choosing a transplant clinic. Okay, cost is always secondary. Cost varies from person to person. Any doctor can charge any cost according to his or her own wish. So cost does not matter at all. Okay, next thing is, are PRPs compulsory? No, not at all compulsory. PRPs are not at all compulsory. We normally do not advise PRPs to our patients. By our patients, I mean the patients that we are doing the transplants. We get the results of all the transplants without any PRP. So PRPs are just not compulsory, but if you have got it done transplant from anybody else and he has prescribed you PRPs, go for it. Always follow instructions of your doctor. Never ignore them or disobey them. Okay. Next question is medicines after surgery, that how many months do you need to take the medicine for surgery. Normally most of the doctors, they prescribe medicines for initial 6 months after surgery. After that, if you have a good quality of hair, you have thick hairs, normally they are not required, you can just discontinue them if you're not having existing hair fall loss or progressive hair fall loss. But if you're having progressive hair loss and existing hair loss, or you're having weak hairs, then you may need to continue some of the medicines. that you can just consult your doctor or visit your doctor once again, and he can guide you accordingly. Always be in touch with your doctor so that you don't have a progressive hair loss. Your doctor may slow your progressive hair loss. Eventually, he may not prevent it, but definitely he can slow it, and he can give you more time of your existing hairs. Will booking be required for hair transplant? Yes. You need to book your date in our clinic by depositing 2000 rupees in advance. We are not free, neither are you. Our time is costly, so is yours. So you need to book your date to confirm your slot. Once your slot is confirmed, then you need to come on the specified time and specified date for your surgery. Any other questions? You can just message me in the messages. Thank you.